My name is Dr. Ryan Kiemeyer. I'm one of the neuroimmunologists working at both the Children's Hospital of Colorado and University of Colorado to take care of kids and adults with neuro-rheumatologic diseases and autoimmune neurologic disorders. And I'm here to talk to you about neuro-rheumatologic disorders that we treat here at our center. And specifically, we're going to talk about neuropsychiatric systemic lupus erythematous, neuro-Sjogren's disease, and vasculitis. So my only disclosure is that I have served on the advisory board for Genentech, but not relevant to the topic of this talk today. So, as I mentioned, there's a number of different neuro-rheumatologic disorders, and we are going to talk about the subset of the most common neuro-rheumatologic disorders we see and treat at the University of Colorado and Children's Hospital of Colorado. So rheumatology is the branch of medicine that studies autoimmune diseases of the joints, the bones, and the soft tissues of the body. And so there are a number of diseases that rheumatologists take care of, some of which can have inflammation spill over into or affect the nervous system as well. And so maybe that a rheumatologist has made a diagnosis of one of these diseases that is affecting the rest of the body, and then notices neurologic changes, and so involves us for care. Some of the most common rheumatologic diseases we see neurologic involvement in include lupus, Sjogren's disease, and vasculitis. So sarcoidosis is another common one, but that's a longer discussion and part of a different talk. We also can see it with rheumatoid arthritis and scleroderma. So inflammation in lupus can affect all organs in the body, and including the brain and the nerves. And so in lupus, the body's immune responses are overactive, and they may start to produce immune cells or antibodies that attack and cause dysfunction of these various organs. And so when it affects the brain or the nerves, then we term this neuropsychiatric systemic lupus erythematous, or NPSLE. So some of the syndromes that we can see are in NPSLE are very diverse. Just like the manifestations of lupus can vary greatly from person to person, so too can the neurologic manifestations. And this can make it very challenging to diagnose and treat appropriately. The syndromes of NPSLE can be broken down into major syndromes, so neurologic changes that are likely getting a full evaluation for an underlying cause. And this can include seizures, strokes, uncontrolled movements, or confusion as a few. Depending on the status of the lupus and the organ function in the rest of the body, some of these may be related to inflammation of the lupus, but some may also be from other causes like high blood pressure, electrolyte changes, or blood clots. And for that reason, many of these patients will receive MRIs, spinal taps, electroencephalograms to look at brain waves, and blood tests to try to see how these syndromes are related to active inflammation, if at all. Minor syndromes are more difficult to assess. These include headaches, more mild or moderate depression, anxiety, or mild dysfunction of thinking, which is noticeable, but still being able to do things in their lives. These are difficult because they happen often in people with lupus, and even when inflammation seems to be very well controlled in the rest of the body. These symptoms are also very common in people without lupus, and so testing for this may be focused or may involve monitoring or trials of non-immunotherapy medications, such as anti-headache medications or antidepressants for help, instead of immune therapy. So Sjogren's disease is an autoimmune disease that will typically cause significant dry mouth and dry eyes, and may also cause joint issues and other various things throughout the body. There are a few antibodies that are most related to this disease and assist the rheumatologist in making this as a diagnosis. The inflammation from Sjogren's, if affecting the nervous system, is usually focused more on the nerves running from the spine to the skin, muscles, the intestines, and the blood vessels in the body, also known as the peripheral or the autonomic nerves. And this can cause a host of symptoms ranging from loss of sensation, burning pains, poor balance, especially at night, or weakness, to stomach and intestine issues, lightheadedness, and urinary difficulties. Yeah. So looks like I forgot to click to the next slide for that. Let me kind of go through. Yeah, yeah. Let me just kind of redo a little bit of that. So I think I'd stopped kind of when I said the peripheral or the autonomic nerves. So this can cause a host of symptoms. And so if affecting the peripheral nerves, this can range from loss of sensation, poor balance, especially at night, burning pains, or weakness. And if affecting the autonomic nerves, the nerves that automatically work within our body without us having to pay attention to them, this can cause stomach, intestinal, or urinary dysfunction, lightheadedness or passing out frequently, blurry vision, or decreased sweating. Rarely there can be inflammation of the brain or the spine, showing up as inflammation of the spinal cord, inflammation of the optic nerve, or demyelination or vasculitis in the rest of the brain. We can also sometimes see cognitive issues show up as part of the neurologic involvement of Sjogren's. And overall, this is a very difficult diagnosis to make, as a number of these symptoms are not easily tested and may be seen in a number of other diseases or for a number of other causes. And so sometimes we will ask for more detailed testing of the functions of the autonomic nerves or the peripheral nerves to help see if those nerves are truly malfunctioning. And let me restart a little bit. Overall, this diagnosis is very difficult to make, as a number of these symptoms are not easily tested, may be seen in a number of other diseases or for a number of other causes. So sometimes, to assess the autonomic nerves, we'll ask for more detailed testing of the functions of these nerves from specialty labs across the country to help see if the autonomic nerves are truly malfunctioning. For the peripheral nerves, we will sometimes do conduction studies, testing the integrity of those nerves, and to test the integrity of those nerves of the limbs. Or we may have a small skin biopsy to look for impairments and damage to smaller nerves. This is usually a collaboration with our neuromuscular doctors and other centers, and so the testing may take some time to complete fully. And we also treat vasculitis affecting the brain. So vasculitis is inflammation of blood vessels, and it can affect multiple parts of the body, kidneys, lungs, sinuses, or eyes being some of the most common causes for vasculitis that's throughout the body. When it involves the brain, it can cause fever, persistent headaches, strokes, seizures, or swelling of the brain. And sometimes it can also cause neuropathies, so injury to the nerves going from the spinal cord to the muscles. And there's a number of different kinds of vasculitises. There are a number of different causes of vasculitides. And so we assess for all of these to try to find the primary and underlying cause for the inflammation. So for all of these neurologic and rheumatologic diseases, we will assess for markers of current inflammation throughout the body, usually through blood tests. An MRI and a lumbar puncture, a spinal tap, can also help give some information. There are certain antibodies that are sometimes associated more with a vasculitis or Sjogren's disease or neurologic lupus, and so we'll test for those. If there's thinking changes or cognitive changes, neuropsychological testing, kind of very detailed testing of memory and cognition will be done. And then there's a number of other tests that we will sometimes use to help clarify what is causing their symptoms. Some of the treatments end up being a partnership between us and the rheumatologist to try to find the ideal treatment plan for not just the neurologic symptoms, but the patient's whole disease. And so the rheumatologist will sometimes use other medications to address inflammation in other parts of the body. And so they'll have thoughts on the ideal treatments, knowing the status of those organs or the disease in the rest of the body. And we kind of give our thoughts, knowing what seems to work best for patients who have neurologic issues related to these diseases. So for all of these diseases, if things are worsening quickly or if there's kind of big changes initially, IV steroids are a way to calm down inflammation quickly. More longer term, we can use infusions such as rituximab to help work on decreasing antibodies that may be causing difficulties within the body. And then sometimes we'll also use oral medications, one of which is called Cellcept, but there are a number of others that we use and can use. So thank you for your attention to this talk. We are actively involved in research with these neuro-rheumatologic disorders. And if there is, if you're interested in seeing how you can support some of that research or helping support some of our collaborations with multidisciplinary clinics between rheumatology, neurology, neuropsychology, and psychology, please reach out to the Rocky Mountain MS Center for more information on how you can support those efforts.